Hi, this is Wendy. Welcome to the presentation on health policy analysis. A goal for becoming a doctor of nursing practice is to be able to influence healthcare practice. One effective way to do that is to be active in the policy arena. We must be able to analyze policy proposals and policy implementation to evaluate the best and necessary actions to take on behalf of our patients, healthcare organizations, and for our profession. The Centers for Disease Control defines policy analysis as the process of identifying potential policy options that could address your nurse practice problem and then compare those options to choose the most effective, efficient, and feasible one. Conducting a policy analysis is important because it ensures you have gone through a systematic process to choose the policy option that may be best for your situation. Policy analysis can be both a retrospective look at the policies that are in place, as well as studies that focus on the development and implementation of policy. We can look at past policies to see how effective they were, or we can analyze policies in their development and as they are being proposed within the legislative process. Often we look at policies that are being proposed and a number of policy options that are being developed to determine which option is most feasible and beneficial to implement given the policy objective. A study of the history of policy analysis shows that there is a trend from thinking about policy analysis as a purely technical process to moving towards a process of creating shared meaning. The lens or the way that a purely technical process is viewed is one that emphasizes rationality. However, the political process is rarely rational and linear, but actually it tends to be more evolutional and often conflictual. Policy is typically dealing with community norms, and most individuals like the status quo and are opposed to change. There are a number of steps that you need to take to be successful at analyzing health policy. First, you will want to identify possible policy options by doing a little research of the literature, scanning the practice environment, and by surveying stakeholders on best practices. Next, you will want to describe and document possible policy options, including their health impact, cost of implementation, and feasibility. Finally, you will rank or prioritize each policy option based on health impact, economic and budgetary impact, and feasibility, and then choose the one that you think is best for your situation. The CDC has some real nice tools on their website to assist in these policy analysis steps. Here are a number of questions you will want to ask when analyzing a policy. This slide gives a list of framing questions. I will give you a moment to read them. Other questions that you will want to ask when analyzing a policy relate to the public's health and whether or not the policy change is feasible. Public health questions look at the impact to the public's health. They consider the potential for the policy to impact risk factors, quality of life, disparities, morbidity, and mortality. Public health questions align with the principles of public health, such as the principle of providing the greatest good for the greatest number of people. Questions look at the magnitude, reach, and the distribution of benefit and burden. Feasibility questions determine the likelihood that the policy can be successfully adopted and implemented, such as what are the current political forces, including the political history, environment, and policy debate. Feasibility questions fall into the categories of politics and operations. The CDC states that when assessing feasibility, it is important to identify critical barriers that will prevent the policy from being developed or adopted at the current time. For such policies, it may not be worthwhile to spend much time analyzing other factors, such as the budget or the economic impact. However, by identifying these critical barriers, you can be more readily able to identify when they shift and how to act quickly when there is a window of opportunity. Questions that relate to economic and budgetary impacts provide a comparison of the costs to enact, implement, and enforce the policy with the value of the benefit. There are a number of helpful tools to use when comparing policy options that provide a subjective way for you to grade each of the categories for policy analysis. One such tool can be found on the CDC website. I encourage you to explore the literature for a model and the tools that are out there for policy analysis that fits best for you. While these tools are very useful in the legislative policy arenas at both the state and national levels, these tools can be incorporated into policy changes at the local or even institutional levels. You will find these tools helpful when you are making a practice change and need to make a decision between options. Involving your stakeholders in policy analysis can be a very effective way to gain buy-in to a practice change and to collaborate effectively in determining the best policy option at the practice level. I encourage you to be an influencer of positive practice change by incorporating tools that help you and your team analyze current policy and options for a potentially preferred policy.